Good morning, good afternoon, everyone. Excited to be here. This is my first HITLAB event, and the sessions so far have just been tremendous. I'm Jefferson Lin. I'm a technology transactions and IP attorney at Fenwick and West, focused on advising digital health startups. And today, I'm going to dive into something that's increasingly critical for healthcare and healthcare startups, the legal risks associated with AI. I could probably spend an hour or more on this topic, but since I only have 15 minutes and won't be able to dig into every potential legal issue related to healthcare AI, like a law school exam, I'll use a hypothetical scenario to make these concepts a little bit more tangible and relevant to how AI is being deployed in patient care. Just quick disclaimer, information I'm presenting is, again, for informational purposes. I'm a lawyer, not your lawyer, and this presentation is not legal advice. Um, let's see. Yeah. So to kick us off, I was listening to the Dwarkesh podcast, a great podcast to listen to. There was a bit of this session with Microsoft CEO Satya Nadella talking about AI, but then he was talking specifically about the legal barriers and some of the legal challenges to AI, and just wanted to share this quote with you. And yeah, he just hits on a core challenge, sort of our world, our laws, our entire society is built around human agency, human property, human rights, human liability. And so as we start to delegate more authority to AI, and especially in critical areas like healthcare, our existing legal structures are stretched and challenged. So while the tech is amazing and rapidly evolving and what it can do, the questions around what it should do and how we hold it accountable are going to be just as important. And the legal framework is oftentimes playing catch up to the rapidly advancing AI capabilities. So I wanted to introduce the audience to our hypothetical client today, Receptionist AI. They've developed an exciting AI system designed to triage patients in medical clinics, helping to prioritize the most urgent cases. So imagine all the efficiency gains from this AI system. But as they prepare to license this system to a clinic network calling Care Connect, they're understandably asking some important and tough legal questions. And so in the presentation today, I'm going to try to frame our discussion around our hypothetical client questions. So the first client question is around privacy. How do we ensure our AI complies with HIPAA and other privacy regulations? And I'm not going to spend too much time here. Daniel and Tracy from DLA Piper gave a great overview and had a great discussion about the privacy issues related to healthcare AI and some of the gaps and some of the important things to watch out for. But in this sort of hypothetical context, as the AI is handling patient health information, connecting with medical records, um, most likely ingesting information about patient symptoms and diagnoses, this is highly sensitive data. And so the big law here, of course, in the US would be HIPAA, which mandates how this data should be protected. And there are rules around the technical safeguards like encryption, administrative safeguards around how the staff handles the data, as well as physical safeguards around sort of how to protect the computer systems. And in this scenario, because our client receptionist AI is handling Care Connect's patient data, they will most likely need what's called a business associate agreement or BAA, which is a special contract that legally obligates both parties to protect patient data according to HIPAA. So it's something that's required under law. While it's sort of non-negotiable, it is that the terms of the BA can be negotiated. And one of the things I see startups do is sort of just not really review the BAA that's presented, oftentimes by a health system or by a health payer, and just sign it. Oftentimes there are additional provisions within that BAA to look out for or watch out for. And one of the things that Daniel and Tracy mentioned was sort of rights around data and rights to de-identified data. So those are some important provisions to look out, especially if that's going to be core to the startup's business. Beyond HIPAA, again, depending on where the patients and parties are located, other state privacy laws like California CCPA or even international laws like GDPR could add more requirements. Another thing that I've been seeing more and more is with these AI systems, if there's a chatbot involved or a recording of phone calls, state wiretapping laws such as California's Invasion of Privacy Act could also be implicated, and additional consent can be needed in those situations. So um, um, the next client question that we have is around IP. How do we protect our IP while allowing the customer Care Connect to customize? And so this is a very common question and tension. And so oftentimes the answer here lies in making sure uh, we're carefully crafting the license agreement or the MSA. And so the document is going to cover business terms, but it's also going to define the rules of engagement. So I would want to know, what does Care Connect want to customize specifically? Is it the branding? Is it the workflow integration, specific reporting features? Do they want to modify certain logic with the triaging? Um, what um, what can Care Connect see? Will they have access to the underlying code? Um, who's going to own the new features developed? So, um, with this question, looking carefully at the IP provisions in the contract are going to be critical, and making sure, again, if we're representing receptionist AI here, one, identifying what is the core IP, right? It could be the trained model, it could be novel algorithms, the source code, proprietary data sets, how the data was curated, system architecture. Any customizations for the customer could potentially be license backed, or ownership could stay with Care Connect if it's sort of more of a peer configuration, but it should be explicit. One of the things I see with startups, they may unknowingly agree to sort of work product or IP assignment provisions that say IP generated in connection with the services performed by the vendor, or at the customer's request becomes the IP owned by the customer. So this can be very problematic in terms of protecting the startup company's IP. And so it's crucial to make sure that it's not structured as a development agreement where the vendor is creating custom code that's being owned by the customer. So other things to sort of watch out for are the confidentiality provisions, again, ensuring that Care Connect here doesn't misuse or share receptionist AI's proprietary information. We'll also want to make sure sort of robust use restriction provisions are in place to ensure Care Connect doesn't try to steal or reverse engineer any IP. Um, Another question from our hypothetical client here is around bias, right? What are the risks of bias in AI, and how can we mitigate them? And so this is sort of one of the biggest ethical and legal risks now in AI. As we know, AI learns from data it's trained on, and if that data isn't diverse or it reflects existing societal biases, the AI will unfortunately learn and perpetuate those biases. And in healthcare, this is especially critical. And with a sort of triage AI system here, it could potentially mistakenly deprioritize certain patient groups, leading to delayed care or worse. So again, mitigation involves using, diverse training data, constantly testing the AI's performance across different demographics, and in this context, remembering that AI is a tool, and should be used with human oversight, with clinicians sort of making the final call. Um, the sort of fourth and final question that we'll sort of discuss here is around liability, and probably one of the most daunting questions. What happens if the AI makes a mistake, and a patient is harmed? And so this is a really complex area of law that's still evolving. And generally, it's not a single point of failure. Responsibility can be shared between the AI developer, here, Receptionist AI. It could be shared with the healthcare institution, Care Connect, as well as the individual user. So it could be the physicians or nurses or other staff. So again, key protections through contractual language are going to be important for Receptionist AI, including clear disclaimers that AI is a support tool or a technology platform, not a doctor. Other legal provisions and clauses like indemnification should be carefully reviewed and negotiated. So, who pays if something goes wrong. Um, Insurance provisions are going to be really important to consider. And, in addition to sort of malpractice insurance requirements or product liability, we're also starting to see insurance products specific to AI sort of risks. So there are insurance companies, for example, offering endorsements to expand usually cyber coverage to address risks like data poisoning. So what if attackers manipulate input data to compromise the outputs of AI models? The coverage might include covering infringement issues around the AI model incorporating copyrighted material. And the coverage could also cover regulatory violations. So violations of, for example, the EU's AI Act. So something to think about and explore, especially again if you're deploying or developing these AI tools. So those were the client's questions, but as lawyers, we're also wanting to examine and look at what hasn't been asked, right? And in AI, there are definitely some other sort of red flags to look out for. One of the biggest for healthcare AI is FDA regulation, and so a big question here that the client didn't ask is the receptionist AI system considered a medical device? And if so, it can face a rigorous and costly FDA approval process, which can be a game changer for any startup. So, and in this case, while the name receptionist AI may sound fairly benign, if it's triaging patients in medical clinics and helping prioritize urgent cases, we definitely would want to engage FDA counsel or FDA expertise here to see how the FDA might classify it as a medical device. Examining what the intended use here and whether it would affect uh, how it would affect clinical management and potentially the outcomes of diseases or conditions. So again, super important question to ask here, that again we could spend a whole nother presentation on. Um, and lastly, I know we're getting to time, but some of the key takeaways around anyone building or implementing AI in healthcare. The first, again, is engaging legal counsel early, being proactive is going to be far cheaper than reactive litigation. Being transparent about what AI does and doesn't do, documenting decisions and test results. Um, Third, embracing the human in the loop principle. While there's sort of more talk and discussion about agentic I think again with clinical solutions and direct patient care, that human oversight is going to be important. Fourth, AI isn't static. It's going to, compared to traditional medical devices, there's going to be more continuous monitoring. And again, the risks are significant, but they are manageable. And with, again, thoughtful planning and legal counsel and partnerships, AI can, I think, really be transformative for healthcare. So I know that was a lot in 15 minutes, but just want to thank you for your time. Feel free to reach out if you have any follow-up questions over email. Happy to connect over LinkedIn as well.